should become white like this. Release the ulnar artery and the color should be returned to the hand. And the second picture shows that. And release the ulnar artery and the color of the hand should be returned. This ensures that there will be still a blood supply to the hand should the ABGs causes a blockage in the radial artery. It means Allen test is a positive. If put on your gloves and attach the needle to the heparinized syringe. Also prepare your local anesthetics and give a small amount over the palpable radial artery. Take the cap off needle and flush the heparin through the syringe and again locate the radial artery using your non-dominant hand. Let the patient know you are about to proceed and to expect a sharp stretches. Insert the needle at 30 degrees to the skin at the point of the maximum pulsation. Where you feel the pulse, insert the needle at the angle of 30 degrees. That is the radial artery. Advance the needle until arterial blood flushes into the syringe. When you feel the pulse with your non-dominant hand, insert the syringe whenever you feel the pulse. Insert the syringe at the point of pulsation and gush of blood come into the syringe, and it's mean you have to take the blood for ABGs. The arterial pressure will cause the blood to fill the syringe. And then remove the needle syringe, placing the needle into the bag. Press firmly over the puncture site with the gauze to halt the bleeding. Remain presses for 5 minutes. When you release the needle, apply the pressure on the puncture site with gauze. Remove the needle and discard safely in the sharp bends. Cap the syringe, put out any air within it, and send immediately for analysis. Ensure that the sample is packed in ice. Remove your gloves and dispose them in the clinical waste bin. Wash your hand and thanks to the patient. An extension to this station could be blood gas interpretation. Before attempting to interpret the result, you should know whether the patient was on room air on the oxygen when the sample was taken, and if on oxygen, what concentration. It will also useful to know whether the patient has a temperature or not, and this should be clearly written on the sample. And what is an ABGs? Arterial blood gases drawn from artery, radial, brachial and femoral. It is an invasive procedure. Caution must be taken with the patient anticoagulants. Helps differentiated oxygen deficiencies from primary ventilatory deficiencies from the primary acid-base abnormalities. Common terminologies: PCO2 ventilation, it's mean partial carbon dioxide. PaO2 oxygenation, that is a partial oxygen. SCO3 metabolism, bicarbonate. O2 SAT oxygen saturation. pH acid-base balance, and BE base axis. These are the common terms you have to remember that. And normal ABG's value: pH, normal pH 7.35 to 7.45, PCO2 partial carbon dioxide 35 to 45 millimeter Hg, and PO2 partial oxygen 80 to 100, and HCO 3 22 to 26 milliliter, and oxygen saturation greater than 95%. You should have to all of these things remembered. What are the contraindications of this procedure? Maybe a bleeding diathesis, AV fistula may be found, severe peripheral vascular diseases, absence of an arterial pulses, infection or over the side. And complication, the most common complication from an arterial puncture is metastasis or hematoma at the sites. Less common but important complication are thrombosis in the arterial and infection at the site. Okay, now we have to go through this lecture. First thing is what is the arterial puncture and how to do and why are we perform the arterial puncture. There is the indication of the arterial puncture is that we can analyze for ABGs, arterial blood gases, and how to perform the arterial puncture and which artery you can use for arterial puncture. Radial artery is the most common artery you can use for the ABGs, and before the arterial puncture, you have to check the Allen test. What is the Allen test? Allen test is that you ask the patient make a fist, and you have to put your both hand on radial artery or ulnar artery. Press the both arteries and ask the patient open the hand, and you can see the color of the hand is white, and you have to release the ulnar artery first. If the pinkish color is returned to the hand, it means Allen test is negative. That is clear. If a Allen test is positive, you can't do this procedure. Is it clear? And then which equipments we have to use in this procedure? Arterial puncture needles, gauzes, gloves, and sharp bends, and heparin cap, and local anesthetics, which is called xylocaine, and povidone, to clean the surface area with povidone, and all of these things you gather up. And then procedure, how to do this procedure. First, introduce yourself. First, wash your hand, introduce yourself, identify the patient, and take a consent. And tell the patient for the procedure, because this procedure is an invasive procedure. And how to do? When you feel the pulse of radial artery, feel the pulse of radial artery. Whenever you feel with your non-dominant hand and feel the pulse, and prick it from your needle. The gush of blood come into the syringe. It means you have to going right side. Then you need the blood from 2 ml, 3 ml. What do you want? So then apply, then remove the needle and press the puncture site with gauze, approx 5 seconds to 10 seconds, and release them. And then apply the heparin cap on the needle and transport in the laboratory. Transport for the laboratory in the icing bags. okay, this is a procedure of arterial puncture and Allen test. And what is the Allen test? ठीक है, ये सारी चीजें मैंने आपको बता दी. And then what are the contraindications for bleeding diathesis, heavy fistula, severe peripheral vascular diseases, absence of an arterial puncture, and infection over the side. These are the contraindication. You can't do this, the arterial puncture on this situation. And the last thing is complication. The most complication is the hematoma or a hematemesis. And the less common but most important complication are thrombosis in the arterial and infection at the site. That is clear? Now I will sharing you a video.
Arterial blood gas sampling, or ABG, is a commonly performed procedure that involves the direct puncture of an artery to obtain an arterial blood specimen for analysis. It allows us to assess gaseous exchange levels within the blood, related to the functions of the respiratory, metabolic, or renal systems. ABGs provide a speedy, bedside investigation that can accurately guide the management of critically ill patients. Therefore, it's an important skill to be able to perform well and with confidence. The indications for performing an ABG are fairly extensive. However, in the acute setting, the main reasons include measuring the partial pressures of oxygen and carbon dioxide in the critically unwell patient to identify the presence of respiratory failure. Additionally, it allows us to determine whether the patient has type 1 or type 2 respiratory failure, so essentially whether the problem is one of oxygenation alone or related to ventilation. ABGs can also guide respiratory interventions, such as when to commence mechanical ventilation, as well as allow us to monitor a patient's response to these interventions. They can be used to monitor the acid-base status of a diabetic patient with ketoacidosis who may be receiving insulin infusion treatment. And also, they can be performed to identify metabolic, respiratory, or mixed acid-base disorders. Absolute contraindications to performing ABG sampling from a patient's radial artery include an abnormal Allen's test, if the patient has known or suspected peripheral vascular disease of the limb, local infection or severe burns at the site of the planned arterial puncture, and also if the patient has an arteriovenous fistula or a vascular graft, in which case it's essential that we stay well away from these sites. Relative contraindications mainly consist of factors that can affect the patient's ability to clot, including medications such as warfarin, heparin, and thrombolytic agents, and also if the patient has a severe coagulopathy. Because of the superficial nature of the radial artery, this is the most common location from where we obtain the sample. However, if there are concerns regarding the use of this site, then the brachial or femoral arteries may be used. But we won't be demonstrating the use of these sites in this video. As with all procedures, we start by introducing ourselves, then checking the patient's identity, explaining the procedure, and obtaining their consent. Having ensured that there are no contraindications to performing a puncture at the site of the radial artery, we then need to palpate the artery to ensure that there's a good pulsation. We will use this pulsation to help guide the insertion of the needle. Once we are happy that there is a good radial artery pulsation at the proposed site, we must then ensure that there's an adequate collateral arterial supply to the hand, via the ulnar artery. We achieve this by performing the Allen's test. This involves applying pressure at the site of the radial artery, as well as the location where the ulnar artery should be present. The patient then makes a tight fist, which squeezes the majority of the arterial blood out of the hand. We then release the pressure that is placed over the ulnar artery, and if there is an adequate collateral supply via the ulnar artery, then the hand should be reperfused almost instantly. So in this case, we know that our patient has a good ulnar artery supply. Therefore, during obtaining the ABG sample, if the radial artery were to become thrombosed and blocked, we know that this collateral supply would prevent any ischemia of the hand from occurring, which is obviously really important. If the patient's Allen's test was negative, revealing an absent or insufficient ulnar artery supply, then we would find an alternative site from where to obtain our ABG sample. We may now set up our equipment, either on a sterile trolley or a sterile tray. In performing an ABG sample, we need some gloves, preferably sterile, antiseptic skin solution, sterile gauze and dressing, a sharps container, and the needle and syringe. The needle that we are using has a protective sleeve, which can be placed over the needle once the sample has been obtained. So this allows it to be removed and disposed of safely without the risk of any needle stick injuries. The syringe that we are using here contains heparin, which prevents the sample from clotting. However, some kits may require the needle to be flushed with heparin before use. Some individuals prefer to inject local anesthetic at the site where the ABG sample is going to be taken. However, if performed well, the procedure should be completed in a single puncture. So the additional puncturing of the skin and the discomfort from injecting the local anesthetic itself essentially nullifies any benefit from using local anesthetic in the first place. So in our case, we won't be using it. Once we are all set up, we position the patient's wrist so that it is slightly extended. This causes the radial artery to sit slightly more superficially, which makes accurately locating it a bit easier. We wash our hands with antimicrobial hand wash or gel, and then put on our gloves. We then clean the area with the antiseptic skin preparation. The radial artery is then palpated to identify the exact point to insert the needle. Now this part is a really important part of the procedure, as the more accurately you can determine the location of the artery, the better the chance of successfully puncturing it with our first attempt. In most cases, the radial artery is easiest to locate and access, approximately 3 centimeters proximal to the skin crease of the wrist on the ventral surface, lateral to the flexor carpi radialis tendon, and medial to the radial styloid process. When feeling the artery, try to visualize its course underneath the skin. Now that we're happy that we know the exact location where we want to insert the needle, we can unsheath the needle and hold the ABG needle and syringe between our thumb, index finger, and middle finger, similar to as you would hold a pen, whilst palpating the artery proximal to the point where we're going to insert the needle. Slowly introduce the needle at 45 degrees to the skin, in the direction of the artery. As the needle punctures the lumen of the artery, there will be a flashback and the syringe will automatically fill with bright red arterial blood, often in a pulsatile fashion. If you see an initial flashback, but the syringe doesn't start to fill, you have most likely passed through the back wall of the artery as well. So, gently withdraw the needle a small amount and the syringe should begin to fill. Once the syringe is completely filled, withdraw the needle completely and immediately apply pressure over the puncture site using the sterile gauze. Pressure should be applied for a minimum of 1 minute, but this may require as long as 5 minutes, particularly in patients with coagulopathies or those who are on medications that affect their ability to clot. The needle should then be resheathed, detached from the syringe, and placed into a sharps container. The syringe is then capped, and having safely tidied and disposed of our equipment and washed our hands, we can then take the ABG sample for analysis. It's important to closely monitor the patient to assess for any early signs of complications. If the puncture site is still bleeding, then usually all that is needed is a slightly more prolonged period of pressure. However, it's important to be aware of the possibility of more serious complications so that they can be recognised and acted upon promptly. In terms of complications, significant bleeding or a local hematoma may occur, and this is usually indicative that a laceration of the artery has happened. Large or expanding hematomas carry the risk of causing compression of local structures and potentially causing compartment syndrome. Other complications to be aware of include arterial vasospasm or occlusion, infection at the puncture site, injury to adjacent structures such as nerves or tendons. The patient may experience significant post-procedure pain. And lastly, there is the risk that the person carrying out the procedure may sustain a needle stick injury. So make sure you take all necessary precautions at all times. If you enjoyed watching this video, then make sure you subscribe to our YouTube channel.
A blood gas analysis is performed to evaluate vital functions in the critically ill patient. The blood gas analysis provides information on the acid-base balance and gives you parameters such as oxygen, pH, carbon dioxide, and bicarbonate, together with electrolytes and hemoglobin. The information helps in making diagnostic decisions in order to initiate the right treatment and to monitor the patient's response to the treatment. Since these findings guide your intervention, accuracy is essential, and using arterial blood allows you to assess oxygen status. It is important to perform the arterial puncture in the correct way in order to prevent pre-analytical errors that can lead to incorrect results. Be sure to always follow your local procedures. Before performing the arterial puncture, confirm the patient's identity. If a recent change in the oxygen flow rate has been made, wait approximately 20 to 30 minutes before sampling. Then locate the radial artery. Clean the puncture site with an alcohol swab. For self-filling syringes, preset the plunger to the recommended volume. Locate the artery again. You can use your index and middle fingers to identify the path of the artery. Hold the needle at a 45-degree angle or less and puncture the skin right in front of your index finger, making sure that the needle insertion follows the path of the artery. Stop the insertion when you see a flash of blood entering the syringe, and hold the position until you have collected the desired blood volume. Withdraw the needle and apply pressure to the puncture site. Remove the needle using a safety device. Gently tap the syringe so that air bubbles are forced to the top. Expel air bubbles through the tip cap or into a piece of gauze. Mix the sample thoroughly to dissolve the heparin. Label the syringe with the patient ID and immediately transport the sample to the ABL blood gas analyzer. Enter the patient and sample ID into the ABL analyzer to ensure that the results are linked to the right patient. Mix the sample again to ensure that it is homogeneous, and place the syringe in the inlet to aspirate the sample. Shortly after, you will receive the results from the ABL analyzer that provide you with vital information to aid your diagnostic decisions. Watch the other videos to understand the acid-base balance and learn how you can
Any question? Students, any question regarding this arterial puncture? So you can ask here. And presentation and the video I will be sent on your email address. Any query? Okay, thank you so much. Heparin not is an injection, heparin is an anticoagulant. Okay. And reference of the second video I will be share you both videos and presentation. Any other question? Any other question? Anticoagulant. Okay, thank you so much.